If you are over 50 and still masturbating, there is something incredibly important you need to understand about your prostate health. And most men have never been told this clearly. Let's talk honestly today. Because once you cross 50, your body begins changing in ways that are subtle at first, but very real. Your prostate enlarges, your urinary stream may weaken. You might wake up at night to urinate. Erections may feel different. Ejaculation may change in volume or intensity. And right in the middle of all of that is a simple natural behavior that many men either feel embarrassed about, confused about, or guilty about: masturbation. Now, before you click away, I want you to understand something. This is not a moral discussion. This is not a sensational discussion. This is a medical discussion. Because when we look at the science, real long-term research, what we find might genuinely surprise you. There was a large observational study conducted by researchers affiliated with Harvard Medical School that followed nearly 32,000 men over an 18-year period. That is not a small study. That is not a short study. That is long-term serious data, and what they observed was this. Men who ejaculated approximately 21 or more times per month had a significantly lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times per month. Now, pause with me for a moment. 21 times per month. That averages to about 5 times per week. Not extreme, not obsessive, consistent. But here's what most headlines don't explain. It's not just about the number. It's about understanding what ejaculation actually does inside the male body, especially after 50. Your prostate is a gland. It produces fluid that becomes part of semen. That fluid contains enzymes, proteins, and biological material. When ejaculation happens, the prostate contracts and releases that fluid. If that fluid sits stagnant for long periods of time, especially in an aging gland, it may contribute to inflammation, congestion, and cellular stress. Think of it like circulation in any other system. Movement supports health. Regular ejaculation appears to reduce inflammatory markers inside the prostate. It may help prevent buildup. It may reduce intraprostatic pressure. It may improve fluid turnover. Is it a guarantee against cancer? No. But is it a modifiable protective factor supported by long-term observational research? Yes, and here is what many men over 50 don't realize. As your prostate enlarges, something called benign prostatic hyperplasia, which affects roughly half of men by age 60, you may begin experiencing urinary changes, slow stream, hesitation, dribbling, feeling like you didn't fully empty. Regular ejaculation can help reduce what we call prostatic congestion. That heavy, full sensation some men feel in the pelvis that can sometimes be related to stagnation of secretions. Now let's go deeper. Beyond cancer risk, beyond urinary symptoms, there is something equally important: blood flow. Erections are vascular events. That means they depend on healthy blood vessels, healthy smooth muscle, and responsive nerves. After 50, vascular elasticity declines. Testosterone levels may gradually decrease. Endothelial function, the lining of your blood vessels, becomes less efficient. When you achieve erections regularly, you are essentially exercising the pineal vascular system. You are increasing oxygen delivery to tissue. You are maintaining elasticity of the corpus cavernosum. You are preventing smooth muscle atrophy. This is often summarized in a simple phrase: use it or lose it. Men who stop all sexual activity for extended periods, whether due to widowhood, illness, relationship changes, or fear, often experience accelerated erectile decline, not because masturbation is magic, but because regular erections maintain tissue health. Now, here's something else most men are never told. Orgasm triggers a cascade of neurochemicals. Dopamine, reward and motivation; oxytocin, bonding and relaxation; endorphins, natural pain relief; prolactin, involved in sexual satisfaction and neurological modulation; serotonin, mood stabilization. After 50, many men are navigating career pressure, financial concerns, retirement anxiety, relationship shifts, health fears. Chronic stress elevates cortisol. Elevated cortisol increases systemic inflammation. Chronic inflammation is associated with cardiovascular disease, metabolic disease, and even cognitive decline. Sexual release, including masturbation, has been shown to reduce stress hormones temporarily and promote parasympathetic nervous system activation. That or relaxed feeling afterward, that is physiology. Improved sleep quality is another benefit frequently reported. Orgasm can shorten sleep latency, the time it takes to fall asleep, due to that neurochemical shift toward relaxation. Now, let's address something directly. Is there such a thing as too much? Yes. Is there such a thing as unhealthy patterns? Yes. But before we talk about excess, we need to address something that quietly harms many men over 50: day shame. Many men grew up in environments where masturbation was labeled as immoral, dirty, weak, or sinful. From a purely medical standpoint, masturbation in moderation is a normal physiological behavior observed across cultures, age groups, and even in various mammalian species. It does not cause blindness. It does not shrink your penis. It does not drain your life force. It does not cause infertility. These myths have existed for centuries. What we care about medically is balance. Frequency that supports prostate health appears to hover around 15-21 ejaculations per month based on observational patterns. That can include partnered sex, solo masturbation, or nocturnal emissions. The total number matters more than the method. Now, here is where technique becomes critical. Especially after 50, your skin changes with age, collagen decreases, elasticity decreases, natural lubrication decreases. Dry friction can cause microtrauma. Repeated microtrauma can cause scarring. In severe cases, trauma to the tunica albuginea. The fibrous layer surrounding erectile tissue may contribute to curvature conditions such as Peyronie's disease. Is that common from normal masturbation? No, but aggressive, dry, forceful habits increase risk. This is why lubrication is not optional after 50. Water-based lubricants are easy to clean and safe. Silicone-based lubricants last longer for men with drier skin. Avoid excessive grip pressure. Some men compensate for reduced sensitivity by squeezing harder. This creates a dangerous cycle. More pressure, gore nerve dulling, even more pressure. Instead, slow down, change rhythm. Focus on sensation instead of force. Allow time for arousal to build gradually. After 50, your arousal curve may be slower. That is normal. Rushing can lead to incomplete ejaculation, frustration, and even pelvic floor tension. Speaking of pelvic floor, the muscles that contract during ejaculation are part of your pelvic floor. Maintaining healthy pelvic floor function supports urinary control and erectile rigidity. Regular orgasm naturally activates those muscles. Now, here is something that is rarely discussed but important: pornography. Occasional use does not automatically cause harm, but chronic escalating high-intensity consumption can alter dopamine pathways. Some men begin experiencing difficulty achieving arousal with real partners. Novelty becomes required, sensitivity shifts. This is not about morality, it is about neuroadaptation. If you notice you cannot achieve erection without visual stimulation, or you require increasingly extreme material, that is a sign to recalibrate. Moderation matters. Another critical point: pain is not normal. Burning with urination, afterward blood and semen, persistent pelvic discomfort, inability to ejaculate, these require evaluation. Conditions such as chronic prostatitis, urinary tract infections, or other urological issues must be ruled out. Ignoring symptoms is never the right move. Now, let me summarize what we've covered so far. Regular ejaculation after 50 may support prostate fluid turnover to reduce inflammatory congestion, a possibly lower prostate cancer risk, maintain erectile tissue health, improve sleep, reduce stress hormones, activate pelvic floor muscles, support vascular patient. Technique matters. Adequate, no forceful bending, mindful pacing, hygiene afterward, wash gently with warm water, avoid harsh soaps, dry thoroughly. Especially important for men with diabetes who are more prone to skin infections. Here is the big takeaway from part 1 teen. Masturbation after 50 is not a sign of decline. It is not a failure of masculinity. It is not replacing intimacy automatically. When practiced mindfully, it is part of male health maintenance. And in part 2, we are going to go even deeper. We will discuss optimal frequency vis overuse. But when masturbation becomes compulsive, relationship dynamics, testosterone and libido shifts, a cardiovascular consideration, psychological resilience, and when to seek professional evaluation because knowledge removes fear, and fear is what keeps men silent. Stay with me. Now that we've discussed the physiological benefits, let's talk about balance. Because while regular ejaculation supports health, extremes in either direction can create problems. Some men over 50 stop completely. Others escalate dramatically due to loneliness, retirement, boredom, or emotional stress. Neither extreme is ideal. Let's start with abstinence. When ejaculation stops for long periods, some men experience pelvic heaviness, increased nocturnal urination, or a feeling of fullness behind the bladder. This is sometimes described as prostatic congestion. Additionally, prolonged absence of erections may accelerate endothelial dysfunction. The early stages of vascular erectile decline: the penis is vascular tissue without regular oxygenation through erections. Smooth muscle may slowly be replaced by collagen fibers that reduces elasticity and rigidity. This is why men who undergo prostate surgery are often encouraged to engage in penile rehabilitation, maintaining blood flow even if intercourse isn't possible. Now let's talk about the other side. Excessive masturbation. What defines excessive? It's not purely about number, it's about impact. If you are masturbating multiple times per day and it interferes with work, sleep, exercise, social engagement, or relationships, that is not healthy. If you feel unable to stop despite wanting to, that suggests compulsive sexual behavior patterns. Compulsion is characterized by loss of control, escalation, and continued behavior despite negative consequences. That is not about weakness, it is about dopamine dysregulation. Professional therapy can help. Now let's discuss relationships. Some wives or partners misinterpret masturbation as rejection. This is where communication becomes essential. Masturbation does not automatically mean dissatisfaction. Many men use masturbation to maintain frequency when partners have mismatched libido, medical issues, or scheduling differences. Healthy couples can coexist with both partnered intimacy and solo sexuality, but secrecy builds trust. Now let's discuss testosterone. After 50, total testosterone declines gradually about 1% per year on average. Lower testosterone may reduce libido. It may reduce spontaneous erections. It may increase fatigue. But here is something important. Regular sexual stimulation, including masturbation, can help maintain sexual response pathways even when testosterone declines. It keeps neural circuits active. It keeps arousal patterns familiar. It prevents psychological withdrawal from sexuality. Many men assume declining libido means I'm done. Not true. Desire shifts, but it does not vanish. Now let's discuss cardiovascular health. Erectile function is strongly tied to cardiovascular health. The pineal arteries are small, about 1-2 mm in diameter, smaller than coronary arteries. If vascular disease begins, erectile changes often appear first. Maintaining sexual function keeps you aware of vascular health. Sudden erectile decline may signal early cardiovascular disease. Masturbation itself is generally safe for most men cleared for moderate physical activity. If you can climb 2 flights of stairs without chest pain, sexual activity is usually safe. But if you experience chest pressure, severe shortness of breath, or dizziness during sexual activity, consult a physician. Now let's discuss sleep and cognitive health. Orgasm increases prolactin and oxytocin. These support relaxation. Chronic stress damages hippocampal neurons, areas responsible for memory. Sexual release may temporarily counteract stress hormone overload. It is not a cure for anxiety disorders, but it is a physiologic stress modulation tool. Now, hygiene again, because it matters more after 50. Skin infections occur more frequently in men with diabetes or weakened immune systems. Wash gently, avoid scented products, dry thoroughly, especially under for skin if uncircumcised. Now let's talk about warning signs that require evaluation. Persistent pelvic pain, a painful ejaculation, blood and urine or cement, see a significant curvature developing suddenly. Erectile dysfunction that appears abruptly, a loss of sensation. Urinary burning. Do not ignore these. Early intervention prevents complications. Now let me give you a structured, healthy framework. Aim for consistency around 15-21 ejaculations monthly total. Include variety, partnered intimacy when possible. Use lubrication every time after 50. Avoid aggressive grip. Avoid excessive pornography escalation. Pay attention to body signals. Maintain communication in relationships. Seek help if behavior feels compulsive. Here's the most important message I want you to walk away with. Your sexuality does not expire at 50. It evolves, it requires adaptation, it requires awareness, but it remains part of your health. Masturbation is not adolescent behavior, it is adult physiology. When approached mindfully, it supports prostate circulation, erectile health, pelvic muscle activation, stress reduction, and emotional balance. When ignored entirely, decline may accelerate. When overused compulsively, balance is lost. The key is intentional practice. Gentlemen, you deserve evidence-based information, not myths, not shame, not silence. You deserve to understand how your body works, and you deserve to make informed decisions about your health without embarrassment. If this conversation shifted your perspective even slightly, that means we are breaking unnecessary silence. Stay informed, stay proactive. Take ownership of your prostate health. Take ownership of your vascular health. Take ownership of your mental health, because aging is not about shutting down. It is about adjusting intelligently. And when you do that, you remain in